Hi, this is Dr. Kelly Miller, Saving Your Brain. I want to share with you a little bit of information about stem cells and exosomes. I know a bit about this because I'm 70 years old now. At age 50, I got stem cells taken from my own iliac crest, my fat cells, and my blood. It was mixed together. It was injected into my left arm where I just had a rotator cuff surgery the day before, and into my right knee where I had a stretched anterior cruciate ligament that had been around for 17 years. So initially, if in a standard rotator cuff surgery, I was going to be in an immobilizer for 5 weeks. And all they were going to do is have me out and I was going to swing my arm for 5 weeks. I said, the heck with that. I told the surgeon, this was on Wednesday, I'm working Monday. He just rolled his eyes and gave me a nod. And I was working Monday after I had the stem cells on Thursday. And that sling came off within a week. It still took me months to strengthen the tendon because the tendon was totally torn, had to be repaired. However, didn't have any pain, didn't have any discomfort, and as good as new. The knee within a week felt like new, so I know a bit about stem cells. At 70, my stem cells are diminished. So stem cells, we're all born with stem cells. And when we're little, we have lots of stem cells. They hang out around the lymphatics and the capillaries. Yeah, so we all have stem cells and exosomes. We're born with them. When we're little, we have a tremendous amount. And stem cells produce exosomes. They hang out around, again, the lymphatics and the capillaries. As we age, we get less and less stem cells. So at age 70, I don't have any stem cells. So I can't use the standard iliac crest. Where they get stem cells now is from umbilical cords, from women who are scheduled to have C-sections. They do spend $1 million screening these women for things like HIV, hepatitis, herpes, all these different things, any kind of communicable or chronic disease, and they get a clean bill of health. They take these stem cells and then they grow them in a laboratory. They stack them. Second, because what cells do is they duplicate. And these stem cells produce exosomes. So I just want to talk about the pros and cons of stem cells and exosomes a little bit. So many of these facilities are using 3rd, 4th, 5th, 6th, 7th, 8th, 9th, 10th generation stem cells, okay? So like even in our own body, as a cell duplicates over and over and over again, sometimes there's a problem. Stem cells contain DNA, okay? So that's the potential issue you have for a generational stem cell, is that the DNA may be corrupted, and personally I don't want to get that injected in my body. On the other hand, what the stem cells do is they produce lots of exosomes, and the exosomes do not contain DNA, and they contain RNA, and so they're much safer. The delivery system for exosomes can be an injection, like an IV, but most of the time it can be taken intranasally, like through a nebulizer. The great thing about, if we're talking about brain, is that stem cells are too big to pass through the blood-brain barrier. So the only way, if you have a practitioner who's telling you they're going to give you an IV of stem cells for your brain, let me just tell you, they're full of it. Because, did that just go off again? Oh, okay. So because stem cells cannot pass through the blood-brain barrier, okay? However, exosomes can pass through the blood-brain barrier through intranasally, and there's some incredible research for multiple different things using exosomes intranasally, and that's what excites me. If we're talking about brain, the best results are using exosomes through nebulization. the research is very strong in this area thing. If you have an autistic child, I want you to look at our website. We're going to be putting information up here, but the research is very strong in not only animal models, but human models, that these exosomes change the behavior of an autistic individual in days. It doesn't mean that's corrected everything is wrong in your brain. However, it improves things like the socialization, eye contact. What do exosomes do? They put the fire out. What is a common problem in the autistic brain is lots of inflammation. We have mitochondrial energy problems. Okay? We have functional disconnection. We have white matter problems between the left and right brain. We have cerebellum problems. So many of these problems can be addressed by a combination of the bioidentical sequential amino acids and exosomes. So this is really something exciting that we are offering now in the clinic. And so please look at our website, savingyourbrain.com, for more information.